Hey, what's up guys? Dr. Beau here. Today we're answering your question, and it is, how long is a normal chiropractic adjustment? Stay tuned.
How can I help you today?
Hey guys, Dr. Beau here. Like I said, today on Ask Dr. Beau, I get this question a lot from various people. And to be honest with you, it's because our profession is a little unique. You know, a lot of people will be asking, they've asked me, they've asked other doctors, how long is a quote unquote normal chiropractic adjustment? Now, I'm gonna give you guys insights from my practice, and you can take that for what it's worth. In our practice, we have 3 different types of appointments. The first type of appointment is a new patient appointment. So someone that's never been to our practice before, we sit down, we go over their history, their problem, what's going on with them. We may do different orthopedic tests, we may order x-rays, we may or may not adjust day 1, but typically that appointment lasts somewhere around 30 to 45 minutes. Why? Because we need to figure out what's going on with you. We need to ask if there's any pre-existing conditions, is there any contraindications for care, what have you done prior, how long did you do it for, etc., etc. Plus, I want to be able to take the time to connect with the patient, really find out about their lifestyle, who they are, how this is affecting them, how this is affecting their life, and ultimately what are their goals and expectations for entering into my practice and being underneath my care as a physician and as a doctor. The second type of appointment is what we call a re-examination. And what that means is that when a person comes into our practice, I usually will set them up on some sort of very short term, 2 to 3 weeks, care plan, telling them, hey, look, here's where we expect you to be day 1. Here's where we expect you to be in 2 or 3 weeks. And then we are going to sit down and reevaluate and go over all the exact same tests that we did on day 1. So during this 15 to 25 minute re-examination appointment, we literally are kind of copying and pasting what happened in their original appointment. So we're taking them through ranges of motion, the orthopedic tests. We're looking for improvement, or we're looking for decline, or actually we're looking for no change whatsoever. And the reason that we do frequent and periodic re-examinations is because we want to make sure that we are on the right pace, the right scale, the right amplitude, the right repetition for that patient to get better as fast as possible. Sometimes we need to reevaluate our treatment plan and either say, hey, look, you're doing amazing, let's push you out a little bit further, or hey, look, nothing's changed, why don't we do some more imaging, take an x-ray or an MRI or CT, or why don't we work with a physical therapist or your medical doctor and figure out what we can do combined together to give you best outcome. Now, the last appointment, I think this is probably the one that most people are asking about, is how long should a quote unquote regular chiropractic adjustment take? And again, guys, this can scale it can be literally as short as 30 seconds in some practices, up to an hour in other practices. Now, I'm gonna tell you in my practice, the way that we do it is I look at everything as what is a quote unquote patient experience. Meaning this, from the second they walk into the door to the second they leave the door, how long is that time period? In an ideal situation in my practice, it's about 15 to 20 minutes. So I like my patients to come in, they sign in, they sit in our relaxation or our waiting room, and I like them to sit there honestly for about 2 to 3 minutes, no longer than that. But really it gives them a chance to just kind of stop for their day, just kind of breathe, kind of to relax. You know, we encourage our patients, don't grab your cell phone and why don't you just sit there and just breathe for a second? Because chances are you probably haven't done a lot of that. You know, we're such in an environment of go, 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 go. So I like to have my patients sit there for just a couple short minutes, just to have a couple good deep breaths, kind of calm their nervous system down. Then we bring them back into whatever their designated treatment room is. And usually, and I say usually meaning 90% of the time, I've already outlined the therapies that I would like my back office chiropractic assistant to apply to the patient. So we like to use heat, e-stim, cold, hydrotherapy, laser. I like to do all of the quote unquote passive muscle work prior to the adjustment, because it's my philosophy, again, this is just my philosophy, that if I can get the muscles to relax, to be in a state of relaxation, that it's easier for me to deliver a more precise and accurate and well understood chiropractic adjustment. So after about 5 to 7 minutes, I will come into the room. I do a short history with the patient, ask them how they're doing, what's going on, is there anything new? Just kind of give a really quick update, because sometimes it's been a week, sometimes it's been a month since I've seen the patient. And then after that, we discuss briefly what's going on with them today. And again, typically at that point, the patient's always face down because I'm taking the therapy off of them. And then I'll find, evaluate, and then adjust anything that needs to be adjusted and put back into alignment. Now, again, personally, I look not only at the area of complaint, I look full spine, so your neck, mid-back, lower back, but also extremities as well. So your feet, knees, wrists, elbows, hands, ankles, toes even sometimes. And then after that, depending on what is necessary, sometimes I'll follow it up and do my own muscle work. I may do some manual release therapy, or I may adjust an extremity and then show some sort of rehabilitative stretch or exercise that I want the patient to work on when they're at home. Now, my typical face-to-face time with that patient is usually somewhere between 5 and 7 minutes. After that, the patient can then continue to do the stretches and exercises with our chiropractic assistant, or if they feel like they are understanding of what's going on, then they'll go to our front desk and either make their next appointment, or they'll just simply say goodbye if they're already on a treatment protocol. So that's kind of it, guys. There's 3 different types of chiropractic appointments. Again, your new patient appointment, which typically lasts 30 minutes to an hour. And I think that's kind of standard across the entire industry. A re-examination can be anywhere between 15 to 25 minutes. And then my personal chiropractic normal adjustment, my time personally is about 5 to 7 minutes with the patient, but their experience is somewhere around 15 to 20 minutes. All right, guys, if you have any questions about that, please let me know down in the comments. That's what I'm here for, answer your guys' questions. Hope that gives you guys a little bit more insight as far as what a normal routine looks like, at least in my practice. Again, every other practice is different. Some people are in and out within 3 minutes. Other times people will take an hour and a half. So one thing is to make sure though, when you are entering into a chiropractor's practice, ask them, hey, what does a normal adjustment look like? How long should I budget my time? Is there typically a wait time when I get here? Why? Because you just want to be able to plan your day and be able to, be on top of things so you can have the best outcome for your health. All right, guys, have a great one. Talk to you.